please.
So basically labor 4 stages. First stage, from the onset of the pains to the cervical dilatation, complete dilatation of the cervix. Complete dilatation అంటే it can be around 14 centimeters. సో ఇనీషియల్గా less than 3 centimeters అంటే దాని latent phase అంటాము. After if it is more than 4 centimeters, it is called active phase. Both of this corresponds to the first stage. నెక్స్ట్ స్టేజ్ వచ్చేటప్పటికి ఫుల్ సర్వైకల్ డైలటేషన్ టు డెలివరీ ఆఫ్ ద బేబీ స్టేజ్ 2. స్టేజ్ 3 డెలివరీ ఆఫ్ ద బేబీ టు ద ప్లసెంటా. అండ్ స్టేజ్ 4 1 hour అబ్జర్వేషన్ ఆఫ్టర్ ద డెలివరీ ఆఫ్ ద ప్లసెంటా. ఇంపార్టెన్స్ ఆఫ్ లేటెంట్ ఫేజ్ వచ్చేటప్పటికి విల్ హ్యావ్ మోస్ట్లీ ఇర్రెగ్యులర్ కంట్రాక్షన్స్ అండ్ టోకోలైటిక్స్ విచ్ ఆర్ యూటరైన్ రిలాక్టెన్స్. దే షుడ్ బి గివెన్ ఓన్లీ ఇన్ దిస్ ఫేజ్ ఆఫ్ ద లేబర్. నెక్స్ట్ యాక్టివ్ ఫేజ్. యాక్టివ్ ఫేజ్ సిన్స్ సర్వైకల్ డైలటేషన్ ఇస్ ఆల్రెడీ మోర్ దాన్ 4 centimeters and the contractions become more regular, tocolytics should not be given in such cases. Next, the active phase, it is again further divided into accelerated phase, maximum slope and deceleration phase. Importance of tocolytics, they are given when the cervical dilatation is less than or equal to 3 centimeters, which is nothing but the latent phase, and when the period of gestation is less than or equal to 34 weeks, which is early preterm, not a preterm labor. Preterm labor ante period of gestation less than 37 weeks. Prolonged latent phase ante in case of nulliparous it is more than 20 hours, multiparous more than 14 hours.
Preterm అంటే ఏంటి?
Less than 37 weeks. Delivery of the baby less than 37 weeks.
Preterm is delivery less than 37 weeks. Delivery is greater than 37 weeks.
Less
Right?
than.
So that's reverse. Less than 37 weeks. Okay.
So preterm ante onset of labor less than 37 weeks or before 37 weeks. Causes వచ్చేటప్పటికి మోస్ట్ కామన్ కాజ్ ఆర్ ఇన్ఫెక్షన్స్. ఇట్ కెన్ బి యూరినరీ ట్రాక్ ఇన్ఫెక్షన్స్ ఆర్ సిమ్టమాటిక్ బ్యాక్టీరియా, కొరియా, అమ్నియోనైటిస్ ఏదైనా అయి ఉండొచ్చు. నెక్స్ట్ అనటామికల్ కాజెస్ వచ్చేటప్పటికి యూటరైన్ అబ్నార్మాలిటీస్, ఏదో సెప్టేట్ యూటరస్ కానీ ఆర్ ఫైబ్రాయిడ్స్ విత్ ఇన్ ద యూటరస్ కానీ ఏదైనా. నెక్స్ట్ సర్వైకల్ ఇన్కంపిటెన్స్, when the cervix is not able to completely dilate. If it is less than 2 centimeters even at the second trimester, then it is called cervical incompetence. Next, over distended uterus in case of twins, polyhydramnios or large babies. How do we predict the preterm labor? By ultrasound. When the cervical length is less than 2.5 centimeters, which means it is a cervical incompetence. Next, cervical canal. నార్మల్గా అయితే అది T షేప్లో ఉంటుంది. If the opening of the cervical canal with the bulging of the membranes into the cervix further causes Y shape, V shape and U shape. Next, vaginal secretions. Normalga fibronectin, it will be produced before 22 weeks or after 37 weeks. It is responsible for the attachment of the sac to the uterine cavity. If it is being produced between 22 to 37 weeks, then it is a preterm labor. Next, tocolytics. Tocolytics, they are divided into certain classes. One is beta agonists, which includes salbutamol, terbutaline, datodrin, isoxsuprine. Most commonly, they cause pulmonary edema or tachycardia side effect. Next, calcium channel blockers as well as calcium antagonists are used. Calcium channel blocker వచ్చేటప్పటికి nifedipine, which is most commonly used and the safest. Next, calcium antagonist వచ్చేటప్పటికి magnesium sulfate, it's a neuroprotective agent. Side effect వచ్చేటప్పటికి hypotonia cause చేయొచ్చు neonatal. Next, prostaglandin synthetase inhibitors, which is indomethacin. And indomethacin should not be given beyond 32 weeks because of premature closure of ductus arteriosus. Specifically, it is given in case of polyhydramnios, which causes preterm labor. Next, oxytocin antagonist, etosiban is used. Next, progesterone, these are mostly used as prophylaxis rather than for the treatment. Nitric oxide donors, nitroglycerin patches, these are rarely used. So these tocolytics are usually given in preterm, which is early preterm, which is less than 34 weeks. Preterm corresponds to less than 37 weeks, and they are given only in latent phase where the cervical dilatation is less than or equal to 3 centimeters. So lung maturity test ante one is lecithin in sphingomyelin ratio more than 2:1, so it indicates the lung is mature enough. Next, phosphatidylglycerol within the amniotic fluid. Normally the lung maturity is seen by surfactants which has phosphatidylcholine as well as phosphatidylglycerol. As though phosphatidylcholine is majorly secreted, which corresponds to 70%, it is not a better indicator because it is also present in maternal and fetal serum besides the amniotic fluid. Whereas this phosphatidylglycerol, it is present only in the amniotic fluid and it is a storage form of the choline. Hence, it is released into the amniotic fluid only when the lungs are completely matured. So, it is important to note that the phosphatidylglycerol is the final indicator of pulmonary maturity. Next, shake test or foam stability index or the TAP test. So basically the skin consists of lipids, fetal skin or any skin per se, they consist of lipids. When these lipids are being released into the amniotic fluid, when we add some saponifying agent, they form bubbles, which indicates that there is some maturity. Next, Nile blue sulfate test, the same fetal skin cells when they are shed into the amniotic fluid which contains the fat. When Nile blue agent is used, the color changes to orange. So more than 50% of the cells becoming orange indicates lung maturity. This Nile blue test should not be confused with the nitrogen paper test, which is used to differentiate the normal vaginal discharge from the amniotic fluid in vagina in case of premature rupture of the membranes. The vaginal discharge, as we know, is acidic, which turns the paper into red, whereas amniotic fluid, which is alkaline or basic, turns the paper into blue.